My name is Agung Ragujat Kanaparawangsa with student ID number 20025111193. I will start with the introduction. From this background, irritable bowel syndrome or IBS is a common gastrointestinal disorder that interferes with the functional system of the stomach. In the worldwide, there are occurring of 11% of the adult population, and until now there is no specific or sensitive biomarker. So IBS is still diagnosis from the Rome 4 criteria, including abdominal pain, abdominal distension, flatulence, and change in stool consistency and the frequency. And protein loss enteropathy or PLE is an abnormality with rapid loss of the serum protein into the intestinal lumen. The PLE has been observed over 60 different conditions or disease, including the IBS itself. But however, in the IBS, the intestinal protein permeability is generally assumed as to be normal, and there is not yet the systematic measurement of PLE in the IBS. Next.
Hello, my name is Angelia Ephraim Horas with last digit number 055. So I will explain about the proper formulation of this student project. The first one is what is the definition of PLE in IBS. The second one is what method of journal searching is used. The third one is how is digestion and absorption of the certain nutrient. The fourth one is how is RDA. The fifth one is what is the possible risk. And the last one is how to solve the problem.
Hello, my name is Felicia with 3 last digit of name 166. I will elaborate the objectives and benefits of our student project. For the objectives, first, we have to know about the definition of protein-losing enteropathy in irritable bowel syndrome. Second, to know what method of journal searching is used. Third, to discover digestion and absorption of the certain nutrient. Fourth, to discover the RDA or recommended daily allowance. Fifth, to discover the possible risk related to the problem. And sixth, to know how to solve the problem. For the benefits, there are benefits for medical students, which is to learn more about the relation of protein-losing enteropathy and irritable bowel syndrome, including the definition, the digestion and absorption of the certain nutrient, the possible risk related to the nutrition problem might develop, and also the nutrition approach to help solving the problems. For the society, it is to increase public awareness about protein-losing enteropathy and irritable bowel syndrome. Next.
Hello everyone, my name is Putri Zamswari with student ID number 2002511202, and I want to continue the explanation about the definition of PLA, or protein enteropathy, or protein-losing enteropathy. So PLA is a syndrome of abnormal severe loss of serum proteins or albumin into the gastrointestinal lumen. Protein-losing enteropathy is associated with more than 60 etiologies comprising of all gastrointestinal disorder. Normally, there's amino acid are absorbed to be broken down and reabsorb. And there's also inflammation and erosions caused by various gastrointestinal etiologies that lead to the increased permeability of the gut tract, thus inducing extreme loss of serum protein and poor absorption. This led to hypoproteinemia and therefore protein enteropathy. So that's all I can explain about the PLA. About the IBS will continue by my friend. Thank you.
My name is Alexandra Chayaputri Windiarto with my 3 last digit number is 112. Today I'll be explaining about the definition of IBS or irritable bowel syndrome. So irritable bowel syndrome is a common chronic gastrointestinal disorder that typically presents with abdominal pain and bowel alterations. Additionally, the cause of IBS are often inorganic and also multifactorial, with 40 to 60% of IBS patients presents with psychological disorders such as anxiety or depression. The diagnosis of IBS itself is made through Rome 4, which is the updated version of Rome criteria.
Okay, now I will continue the presentation. My name is Matma. Let's read my name R130. The method of journal searching. The literature search was carried out through the 3 online scientific journal databases, namely Science Direct, PubMed, and ResearchGate. The keyword used in the search were protein enteropathy, irritable bowel syndrome, and protein, accompanied by the use of Boolean operators such as and or. The inclusion criteria used in this literature review were 1. Publication in the last 5 years for scientific journals and the last 10 years for textbook. The second, the study uses English or Indonesian. Exclusion criteria is no focus on protein enteropathy. After the literature study was carried out, the literature is then screened and reviewed in terms of validity, importance, and applicability so that 9 journals that obtained are appropriate as the main reference. That's from me. Now my friend will continue the presentation. Thank you.
Hello everyone, my name is Krishna Alatra with the student number of 2002511230. So now I'm going to explain about the digestive and absorption of certain nutrients. Protein digestion begins in the stomach with the help of pepsin, which is secreted in the form of pepsinogen. The final stage of digestion occurs in the broad border of the small intestine with the final form of single amino acids, dipeptides or tripeptides, which will then be transported to enterocytes before finally being circulated through bloodstream.
Greetings everyone, I'm Jenny. So now I'm going to continue about the digestive and absorption of certain nutrient, which is protein in this case. So here we are discussing about the protein enteropathy. So people with protein enteropathy tends to show symptoms such as abdominal distension, which might be caused by the loss of protein that goes through GI tract is more than the need of protein in our body, which then leads to hypoproteinemia. Hypoproteinemia occurs as a result of an inflammation and erosion of GI tract, which then lead to mucosal permeability increase and leakage of serum protein and poor reabsorption. This case might then result in protein loss. That's all for digestive and absorption of certain nutrients. Next will be continued by my friends. Thank you.
Hello, my name is Vero Jonathan. With my last three name digit number is 164. I'm going to continue the presentation about the RDA. The optimum protein intake for adults is 10% of dietary energy or 0.8 gram per kilogram body weight per day. And under stressful states such as energy restriction or ER and physical inactivity, higher rates of protein intakes are needed to release the loss and will be increased to 1.0 until 1.2 gram per kilogram body weight per day. And meanwhile, for adults with acute or chronic disease, would need as much as 1.2 until 1.5 gram per kilogram body weight per day. And lastly, for older people with severe illness or over malnutrition, the minimum acceptable macronutrient distribution range for protein is as much as 2.0 gram per kilogram body weight per day. That's all from me. Next will be continued by my friend. That's all. Thank you.
Hello, my name is Putri Ordinars Listiawan with last three digits student ID number 097. Now I will explain about the possible risk related to nutrition problem that may develop. So PLE is, or protein losing enteropathy, is a condition that refers to a lost protein that occurs through the gastrointestinal tract. And patients with PLE are suspect with protein low serum proteins and act as unusual causes of hypoproteinemia. This clinical presentation may also complicated by micronutrient deficiencies. PLE also cause significant vitamin deficiencies and essential fatty acid deficiencies. For those conditions, like extreme loss of serum protein and poor absorption, can cause by inflammation and erosion that happen due to increased permeability of the gut tract. And also the symptoms of PLE, like feeding intolerance, can increasing the possibility of the patient to have a vitamin deficiency due to inadequate intake of nutrient. Next.
Hello everyone, my name is Igusti Muda Resta Sadiksa with the digit of my name is 145. Today I will continue about the nutrition approach to help solving the problem. In this case, no single treatment dependably further develops protein losing enteropathy in all patients. The central goal is to treat the fundamental illness. Various protein losing enteropathy specific strategies have been depicted and incorporate dietary, pharmacological, or careful intervention. A high protein diet is suggested in patients with protein losing enteropathy and may require fundamentally more prominent protein accumulation to stay in positive nitrogen balance. Albeit dietary may not deliver real advantage as well as side effect on level of protein considering. Okay, that's all from me. Thank you.
Greetings for everyone. My name is Tia Subrata Wirawan and my student ID number is 200251182. And I would like to continue the presentation about the nutrition approach to help the solving the problem. So beside high protein diet, the patient may also need replacement of electrolytes, micronutrients, which is needed to be monitored, especially when the patient consumes fat-soluble vitamins. If a very low-fat diet is used for more than 3 weeks, a source of essential fatty acids will be necessary. And if an oral intake is inadequate or fails, enteral feeding should be considered. Lastly, although dietary modification may not produce significant benefit in decreasing symptoms or degree of protein wasting, the optimization of the patient's nutritional status is important to the success of other therapies and patient's outcome. Thank you.
My name is Putuninda Dewi Rahadi, and I would like to explain about the conclusion of our student project. So, Irritable bowel syndrome, or IBS, is the most common gastrointestinal disorder occurring in 11% of the adult population worldwide. Protein enteropathy, or protein-losing enteropathy, or PLE, which is a syndrome of abnormal severe loss of serum proteins or albumin into gastrointestinal lumen, has been observed in many conditions, including IBS. Recommended dietary allowance, or RDA, of protein intake varies depending on individual condition. In correlation between PLE and nutrition, PLE can cause significant vitamin and essential fatty acids deficiency. There is no single treatment that can cure PLE. The central rule is to treat the fundamental illness, but a high protein diet is suggested in patients with PLE to stay in a positive nitrogen balance. So here's our references to make the student project. That's all from us. Thank you, and we hope this student project is useful.